Hi, I'm Dr. James Padilla, owner of the San Diego Spine and Wellness Center. I'm a current user of ChiroTouch, which I've implemented into my office. And I've used this approximately 2 years now. And I've switched over from a paper office because I wanted to become a paperless office. And in doing so, I've searched probably around 5 different programs. And as a result, I came up with ChiroTouch. And ChiroTouch allows me a very simple way to have a patient check in, enter their information, put them into my open concept treating facility, and from there it will access their information and treat them. I treat probably approximately anywhere between 150 to 200 patients a week, and as a result the process has become a very streamlined event. In addition, my staff has reduce their time in regards to paper, in regards to scheduling, and in regards to collecting payment. It's also brought our office together in regards to communicating with each other in regards to what needs to happen with the patient. I've implemented ChiroTouch at each of my stations, and the first being at my first station, and I put them basically in an area that's easily accessible. And as you can see, my ChiroTouch platform is right here next to my treating facility, which is the Pro Adjuster. So once I'm done treating the patient, I will immediately go over to my soap notes and create the patient's chart note. Nice. Once I'm finished with the patient via either a manual adjustment, Pro Adjuster adjustment, I'll immediately go over to my setup station and enter the patient's chart notes. I'll reconfirm the patient's visit, and I'll make sure that if there are any special notes I need to put into the system that needs to be relayed to the staff, I can do that literally in under 30 seconds. So as a busy practitioner, I was looking for ways to cut down my time with entering information into the either on paper or having my staff do it. So implementing ChiroTouch, one of the features that I really enjoyed was the fact that the patient was able to sign in themselves. And I've chose 3 different ways. The patient can sign in using a barcode, which we use this instrument. They can sign in using a PIN code, or they can sign in using their finger, depending on the preference of the patient. With ChiroTouch, I found my time as far as reports, as far as looking at my statistics for the month and for the week. I didn't have to go into endless amounts of paperwork to put the statistics together. ChiroTouch allowed me to literally using the keyboard within a few strokes, I could see everything at a glance. In addition, for example, getting a receipt for a patient took some time. Now we can locate the patient's visit, print up a receipt, and give them the information they want. In addition, I've gone through countless numbers of software as far as soap notes are concerned, as far as generating, whether it's for an insurance company, for a personal injury, workers' compensation, or even Medicare. And the time frame in which to produce a report was extremely long. Having gone through a number of soap note programs, ChiroTouch has significantly reduced my time. I'm able to reproduce a report literally at the touch of a key, and I can do that again in under 2 to 5 minutes, depending on what I need. I would encourage anyone who's looking into ChiroTouch to really consider the options that ChiroTouch has compared to some of the other softwares, particularly when it brings everything together as far as checking in, as far as looking at your statistics, as far as your soap notes, as far as going paperless in an office, particularly if you want to achieve growth in your practice. ChiroTouch will help you get there.